Now I will introduce Professor Sameh Emam. He will talk about primary versus batch graft closure after carotid endarterectomy, other experience.
عارف الوقت اتأخر والناس كلها جاعت والناس كلها مرهقة. احنا إن شاء الله في 3-4 دقايق هنقول presentation. Let's finish the journey of carotid artery disease. Actually, this is a retrospective study. Was conducted in Al Zahra University Hospital. It was about the primary versus patch graft closure after carotid endarterectomy. To begin, let's define the carotid endarterectomy. The surgical procedure performed to remove the plaque from carotid arteries, which are the main blood vessels supplying the blood to the brain. Surgical indications treating the carotid artery stenosis in high-risk patients to reduce the stroke risk. This study, it was a retrospective study. Actually, it was published at the beginning of this year, 2024, in the Journal of General Medicine. And this is our team in Al Zahra University Hospital under supervision of Professor Atif Allam and Professor Yahya Sadiq, with the eminent head of department, Professor Ihab Al-Fakharani. Many thanks for all of them in helping us to do such papers. Our purpose was to provide our experience with patch graft and primary closure after carotid endarterectomy. The study was conducted on 106 patients submitted to an elective carotid endarterectomy. 50 patients submitted to primary closure and the others subjected to patch closure. How do we decide which technique to use? The choice often comes down to patient-specific factors. Primary closure might be considered for low-risk patients or when a quick procedure is necessary. Patch graft closure is typically preferred for high-risk patients, especially with those with significant arterial narrowing. This is how did we select our patient. Now let's talk about the two main closure techniques used after carotid endarterectomy. The first is primary closure, where the artery is sutured directly without any additional material. The second is patch graft closure, which involves using a patch often made from synthetic material or patient's own vein to widen the artery during the closure. Now we are going to compare between the two techniques. Primary closure has some key advantages. It's simpler and quicker procedures as no foreign material are introduced. This can be appealing in cases where time is critical or when minimizing the amount of foreign material is priority. However, the downside is the artery may be at higher risk of narrowing, again as known as a restenosis. The disadvantage is higher restenosis risk, increased stroke risk to a limited width. On the other hand, patch graft closure has some significant advantages. The use of patch helps to widen the artery, reducing the risk of restenosis and improving the long-term patency of the vessel. However, it comes with its own challenges. The procedure takes longer time and also it's more complex. There is also increased cost associated with the patch material. Let's move to our clinical outcomes associated with both techniques. With primary closure, it tends to be higher incidence of restenosis particularly in the primary months up to the first year following the surgery. However, the procedure is shorter and recovery may be quicker. With the patch closure, long-term outcomes are generally better in terms keeping the artery open and preventing the restenosis. Looking at our research and data, the differences in restenosis rate are quite clear. For primary closure, restenosis can occur up to 15 to 30% of cases, depending on the patient population and other factors. Patch closure, however, significantly reduces the risk with restenosis rates closer to 5 to 10%. A stroke risk also a major factor, while the primary closure has a high risk of a stroke in the first year post-surgery. To summarize, primary closure and patch graft closure both have their place in carotid endarterectomy, but are best suited for different situations. Primary closure may be appropriate for some lower risk patient, but it carries a higher risk of restenosis. Patch graft closure, while more complex and costly, offers a superior long-term protection against restenosis and stroke. And sorry, thank you so very much.